Funding for Diabetes, The Constant Shadow, comes from the Dr. Donald J. Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, providing medical information programming for individuals and families on IdeaStream's broadcast and educational channels, and by the Margaret Clark Morgan Foundation, the Woodruff Foundation, the McGregor Foundation, and the Community Foundation of Lorain County. Diabetes. Tens of millions have it. Many don't even know it, and most of us don't understand it.
Take the disease very seriously because it's no joke.
The stakes are high. Some lose limbs, others lose sight. All are fighting for control.
I know it's something I gotta deal with.
Every decision, every minute of every second, I'm always reflecting on my diabetes.
Welcome to Diabetes, The Constant Shadow. I'm Rick Jackson. This is part of a series of multimedia health specials IdeaStream is presenting on chronic killers. In this episode, we focus on diabetes, a disease afflicting nearly 24 million Americans. The rate of new cases has nearly doubled in the last decade and continues to balloon. And it's closely connected to the obesity epidemic. As you're about to see, it can lead to serious complications and life-threatening emergencies, some of which are startling.
I've been a paramedic here for over 25 years, and diabetic emergencies are unpredictable, bizarre. This particular incident here at this intersection sticks in my mind. What happened here was we got a call for a male. His behavior was inappropriate. So the police thought he was intoxicated, but one of the sergeants felt that maybe it was a medical emergency. We got down here with the ambulance. He was face down on the ground. 2 police cars parked there, handcuffed. And we checked his sugar just to see, because we didn't smell any alcohol in his breath either. And his sugar was low. It was down about 25, with normal sugars like 80 to 120. So we gave him some sugar. Within minutes, the gentleman woke up, and he was one of the nicest people you ever wanted to meet.
You see, when I first developed diabetes, I didn't take the disease as something that was very serious. I've lost all of the toes on this left leg. The right leg is gone from below the knee and all the way down. It's gone.
Diabetes is by far the commonest disease that leads to amputation in this country.
It's just no joke. You can end up on dialysis, you can end up blind, you can lose limbs.
I'm the kind of diabetic that has very volatile, erratic blood sugars, meaning I can be at 300 and drop to 30 in just a matter of minutes. I found out just how dangerous that could be on a normal day, getting in the car, coming home from work. And I figure somewhere around 25th Street or so, or maybe even downtown, I pretty much blacked out. I drove 15 miles on I-71 in the fast lane, totally unconscious, not aware of my surroundings or any other cars. It's amazing that I didn't hit anyone else. I have no idea how I kept the car on the road for so long before I finally did end up hitting a pole. I hit that pole head on. They figure at about 45 miles an hour. They had to use the jaw of life to cut open the top of the car to extract me from it. It's amazing that I'm still alive. It's a miracle. People really have no clue just how dangerous diabetes can be. But now, before I get behind the wheel, I always check my blood sugar.
As we just saw, diabetes can cause serious physical problems as well as debilitating physical ailments. The really scary thing is, diabetes is approaching epidemic proportions, with a 90% increase in cases in just the last decade. But what exactly is this disease? IdeaStream producer Kay Colby explains exactly what happens inside the body of a diabetic.
One way to understand diabetes is to trace the path of food as it's digested in the human body. The food you eat gets broken down to glucose, a form of sugar that serves as fuel to energize cells. The glucose travels into the bloodstream. Here's where an organ called the pancreas enters the picture. The pancreas is located behind the stomach and acts as a factory producing a hormone called insulin that helps the body use glucose. Immediately upon sensing glucose in the blood, the pancreas kicks into action, releasing insulin.
Insulin is a protein hormone and is secreted and binds to a receptor that promotes the transport of glucose into the cell. It's very swift and it's very efficient.
So this is the medical version of what happens. Pretty complex, huh? Well, we're going to simplify it a bit with a trip to a hotel. We're going to the Wyndham in downtown Cleveland.
So how about the 4th floor?
Think of this hallway as a blood vessel. After you eat, glucose, fuel for cells, fills the hallway. Each door to each room represents a cell. But the glucose can't get into the cells by themselves. The pancreas knows this and releases insulin into the hallway, the bloodstream. The insulin unlocks the doors to the cells and glucose glides on through.
It's like a lock and a key situation. It literally turns the key and allows the glucose into the cell.
Diabetes is a disease that centers on problems with insulin. There are 2 main types of diabetes. Type 1 is usually diagnosed in childhood and is a disease in which the body turns against itself, destroying the ability of the pancreas to make insulin.
It literally destroys the factory, burns it down. The factory is burnt down. There is no insulin production left.
Type 1 diabetes accounts for 5 to 10% of all cases. In contrast, type 2 diabetes accounts for at least 90% of cases in this country. While type 2 diabetes occurs most often in adults, it can develop at any age. The causes of type 2 diabetes are quite different than those of type 1. Type 2 diabetes begins with a pancreatic defect, a problem with the body's insulin factory.
The factory is deficient. At time of diagnosis, you've already lost 50% of your capacity to make insulin, and that gets worse over time.
People with type 2 diabetes also have insulin resistance, which means the body does not properly use what insulin it does make. Remember the hotel hallway scene? Well, the insulin people are just not efficient at unlocking the doors to get the glucose guys inside.
They literally can't unlock those receptors and get insulin action with normal levels of insulin. They need very, very high levels of insulin to achieve this. So if you have this problem and you also have a problem in your factory, you can't make enough insulin to overcome this, you're going to have high blood sugars.
While the causes of type 1 and type 2 diabetes are different, the effect is the same. High levels of glucose sit in the blood vessels. One way to diagnose diabetes is to measure the amount of glucose in the blood after a person has not eaten for at least 8 hours. Diabetes is diagnosed when the fasting blood glucose level is 126 milligrams per deciliter or higher, and confirmed with a repeat test. A normal fasting glucose level is 100 milligrams per deciliter or less. Diabetes is really a disease about supply and demand. A healthy body requires a delicate balance between glucose and insulin. The key to managing diabetes is to try and keep that balance, because where excess sugar sits, danger lurks.
Now that we've explained what diabetes is, we're going to show you what it can do to the human body. This is a prosthetics lab, a place where artificial limbs are made. Diabetes is the #1 disease-related cause of amputations of legs, feet, and toes in the country. Amputations and most other complications from diabetes are a result of excess glucose sitting in the blood vessels, which over time causes damage. Damage to large blood vessels can lead to heart attack, stroke, and poor circulation in the legs, which can result in gangrene and amputation. Diabetes also causes big problems in small blood vessels that feed the kidneys, eyes, and nerves in the hands and feet. Tight control of diabetes from the get-go of diagnosis greatly reduces the chance of serious complications. That being said, lots of people live in the shadow of regret because their diabetes is not being properly controlled. In our next report, IdeaStream Health reporter Gretchen Kuda gives us a glimpse into the lives of people who struggle daily with the dreaded complications of diabetes.
Any problems getting it off and on?
Sherry Evans wishes she'd done things differently to prevent losing her leg to diabetes. Evans is a below-the-knee amputee. An artificial leg puts Evans back on track.
I'm not going to be one of those that are going to sit at home and pity myself and feel sorry for myself and say, poor me, pity me, not me.
The process leading to amputation involves both large and small blood vessels. If a diabetic steps on a nail, he doesn't feel the injury because of the damage diabetes has done to the tiny vessels in his feet. An ulcer then develops, and because of poor circulation in the large vessels in his leg, the wound doesn't heal. It gets infected, and gangrene sets in.
Gangrene means death of the tissue. If it's dead, it's dead.
Making legs, feet, and other artificial limbs for amputees is the job of Mark Simmons. It keeps him busy.
Diabetes is more common now than it seems like it was in the past, and unfortunately, this is the end result.
Cleveland has an unusually high rate of amputations, and that's mainly due to its high rate of uncontrolled diabetes. All diabetics need to have regular foot exams. That allows doctors to catch problems early and prevent gangrene. The complications affecting Sherry Evans and many other diabetics stem from lack of access to care, as well as lapses in individual responsibility. Evans lost her health insurance when she lost her job. She also admits that she didn't do other things within her own power to limit the damage from diabetes.
At the time, I wasn't taking care of the diabetes.
It's always a little frustrating on those patients in whom it's preventable to have to do something as destructive as remove an extremity. On the other hand, I think once that decision is made, our approach is to be very positive and focus on the goal of rehabilitation.
What kinds of things would you guys do together then in terms of, trying to figure out how to get around again?
Just basically learning how to walk up a slope of a curb, learning how to go down the stair, up and down the curbs. That's gotten easier.
Besides losing legs, many patients with diabetes lose kidney function. Diabetes and high blood pressure are the leading causes of kidney failure in the United States. To stay alive, patients with kidney failure need a kidney transplant or need to be on dialysis, a process by which a machine removes the blood from the body, filters out the toxins, and returns the blood to the patient.
This is the artificial kidney, which is called the dialyzer, which cleans Ms. Harge's blood and removes any toxins in the blood. Inside are tiny little fibers which work as filters.
3 days a week, 4 hours at a time, Dorothy J. Hargis sits hooked to a dialysis machine.
By the time you get back home, you get adjusted, it's time to come back again.
To get through each session, Hargis relies on her strong faith and supportive staff. Diabetes runs rampant in the Hargis' family. Hargis lost her sister to the disease just 2 years ago and regrets not heeding her sister's warning to get her diabetes under better control and save her kidneys.
I do regret not doing what I needed to do.
Besides affecting kidney function, diabetes is the #1 cause of new cases of blindness in adults under age 74.
What happens in the eye is you have these small little blood vessels, these little aneurysms, like little bubbles, like you'd see in the side of an old bicycle tire, and these little bubbles can leak fluid into the back of the eye.
Those microaneurysms are like the places in the pipe that are broken. And these little areas here, those are areas of lipids or fats that have leaked out of the damaged blood vessel.
Dr. Suber Wong is preparing to use a laser to seal up vessels leaking in the eye of Christian Sheely, who was diagnosed with diabetes 20 years ago.
Okay, I've armed the laser. Terrific, you're doing well. Please don't move.
After a series of beeps and flashes, the treatment is over.
Well, what did you feel?
Really didn't feel a thing.
Laser treatments don't cure the underlying problem of diabetes, but they can help stabilize damage to vessels. The key to preserving vision is to catch problems early. That's why diabetics need regular eye exams. But in medicine, there are no guarantees. Nicole Padone has learned diabetes can be cruel and unpredictable. Padone lost her sight to diabetes at age 22, just after graduating from college.
Okay, ready? Forward.
Guide dog Lorenzo allows Padone to navigate life in total darkness.
I have to push myself. That's how I survive.
One of the newer technology advances helping blind diabetics track their blood glucose is a monitor that talks.
There's a little ledge right on there that I can feel with my nail, and that I know that my strip has to be facing up. Oh, yeah, that's pretty high.
Padone has fluctuating glucose levels, along with other life-threatening complications from diabetes.
My biggest fear is dying at an early age. I've already experienced the deathbed scenario, and I was amazed that I even came out of that, and I'm afraid it's going to happen again.
One option for Padone may be a pancreas transplant, but a transplant is risky and the wait list long due to the shortage of donor organs. For now, Padone relies on a strong spirit, a loving fiancé, and a loyal dog.
Thank you, that's a good point.
Even though diabetes does not show up on a lot of death certificates, it stands as a major killer in this country because of its relationship to heart attacks, strokes, kidney failure, and other deadly problems. But a diagnosis of diabetes does not have to be a death sentence. Many patients are quite capable of managing their disease. As IdeaStream's Kay Colby shows us now, controlling diabetes can become a full-time job that drove one man literally to tears.
Just nail the zone, okay? Let's go. Do it again. Bring it in. Get a call.
Vikes on 3, 2, 3.
As a high school basketball coach, 51-year-old Michael Williams is on a mission to mentor young athletes.
See you later, fish. My road dog.
Along with hugs and encouragement, Williams brings something else to every practice, a glucose test kit to monitor his diabetes.
Yeah, it's my lifeline. I like the glucose meter. Take it everywhere I go, church, basketball practice, work.
Williams was diagnosed with type 2 diabetes 6 years ago. Part of his motivation to keep diabetes at bay comes from being a husband and a father.
I can easily stay in this house and just let it take me down. It'd be easy to do and eat everything that I want, drink regular pop like I want to. I could easily do that, but I'm not going to let it defeat me. I feel I'll be letting somebody else down if I let diabetes beat me.
For Williams, managing diabetes is a 24/7 job. At least twice a day, before meals and 2 hours after eating, he checks his glucose levels.
It still stinks.
At every meal, Williams automatically computes the grams of carbohydrates according to portion size.
What is your read on the carbs there?
Right now, and the greens are probably low in carbohydrates, probably about maybe 5 carbohydrates, probably a little bit about 15 with the mashed potatoes, about 15 with the corn, probably 10 or 15 with the biscuit, and 15 with my banana that I like to eat.
He's able to just look at a meal and know. He just knows.
Helping patients learn to count carbs and implement other management strategies is the job of Kelly Reed. She's a certified diabetes educator. Diabetics need to limit their intake of foods high in carbohydrates like bread, pasta, and rice because they turn into glucose quickly. Diabetics also need to limit their intake of fat and control their weight.
¿Cómo corto esto?
Diabetes forced Justino and Antonia Echevarria to learn healthier ways to prepare some of their favorite Hispanic foods. The daily routine of checking glucose levels has become a kind of bonding agent for the Echevarrias. Both have type 2 diabetes.
It's like a couple thing. One reminds the other one. The only thing different is that I gotta use the insulin and she don't.
Once the pancreas burns out, type 2 diabetics like Justino must go on insulin therapy. For many, that means shots.
So what is the hardest part about learning to give yourself a shot? It's taking the plunge. It's giving that first shot. It's like standing at the end of the diving board, wanting to jump into the water, but scared to step off.
Patients using insulin must learn to think like a pancreas to achieve the correct balance of glucose and insulin. Too much insulin can cause blood sugars to drop dangerously low. That's what happened to Pam Batlak. Before going totally unconscious, she was in a trance-like state driving down I-71.
Then she reaches a certain threshold in her glucose that she can't function, and it's like flicking a switch. She's gone.
That's when Batlak's car slammed into the telephone pole.
And it's really amazing that anybody stepped out of there alive.
Michael Williams also knows how dangerous diabetes can be. Williams is not yet at the point of needing insulin therapy. For now, he manages with oral medications and strict lifestyle controls. Williams watches his weight carefully and exercises daily. Williams also has a checkup every 3 months so his doctor can keep close tabs on his eyes, kidneys, and feet.
You feel that?
Yes.
Right there.
Before each visit, Williams must also have a blood test that provides his doctors with a 3-month average of his blood glucose levels. By necessity, diabetes is a disease of self-management and self-discipline.
I can tell him what he needs to do. If he doesn't do it, it isn't going to work.
Because diabetics face an increased risk of heart attack, Williams also takes great care to control his risk factors for heart disease. Williams's mother died of a heart attack at age 45. For Williams, living in the shadow of diabetes and heart disease is scary.
But I know it's something I got to deal with. And try to be strong for other people. I'm really glad that with my family, church family, and praying, it really helps a lot. And sometimes crying helps too.
And I know he needs to do what he needs to do in order to stay alive.
Diabetes colors your whole life. It's an ongoing process and an ongoing battle, but you should never give up.
Good job out there.
Be sure to visit us at wviz.org/health for links to local resources. You can also listen to our radio-related programming on 90.3 WCPN.
We live in a culture that bombards us with sugar, salt, carbohydrates, fat, really makes it easy to pile on the pounds. Looks so good though. But did you know that 65% of adults in Ohio are overweight and 85% of all type 2 diabetics are? Gretchen Kuda has more on the obesity-diabetes connection and why diabetes is sometimes called a lifestyle disease.
Before you take a bite of that hamburger or supersize the French fries and soda, you might want to get your blood sugar tested. Experts say the choices we make about food and exercise aren't just making us fat, they're making us sick.
It's reckoned by 2010, 10% of the population will have type 2 diabetes.
Diabetes may be America's fastest growing disease, and the big reason diabetes is getting bigger is because Americans are getting bigger too. Americans are among the fattest in the world, and Ohioans are among the fattest in the country. The state ranks 10th in obesity.
Basically, in America and in the Western world, the diabetes epidemic is really the obesity epidemic. There's no difference.
Even thin people can become diabetic, but the odds go up markedly the more overweight you are. Statistics show your body mass index, a ratio of your weight to your height, and the size of your waistline is often the best predictor of your risk for type 2 diabetes.
Gentlemen who have a waist of larger than 40 inches or ladies who have a waist of more than 35 inches have a higher risk for diabetes than those who are below those numbers.
Eileen Seeholzer runs the Weight Management Center at Metro Health Medical Center. Every day, she helps patients like Sheila McGinty battle their weight and their risk for diabetes. McGinty was 26 and the brand new mother of twins when she discovered she was one of the 57 million Americans with a condition known as pre-diabetes. Blood sugar levels that are higher than normal and an early warning sign for developing diabetes. McGinty says she was surprised, but she was determined to do something about it.
I had struggled with weight my whole life, so I figured that I could do this.
McGinty lost 75 pounds and got her glucose levels under control. Studies have shown that making lifestyle changes at the pre-diabetic stage can actually prevent diabetes from developing.
If you followed a program of diet and exercise, and you're in this halfway house between normality and type 2 diabetes, you could have a 58% risk reduction for developing diabetes, just through diet and exercise.
And even small changes can have a big effect. Exercising a few times a week and reducing body weight by a mere 7%, that's about 15 pounds in a 200-pound person, is enough to reduce your risk by half. It's too late for Frances Lantry to prevent diabetes, so she's doing the next best thing, controlling it. Lantry manages her diabetes through a combination of rigorous diet and daily exercise, and does so without any medications or insulin.
So it takes time, but I hate this disease so much
that I'm willing to take that time because it's my battle with this disease, and that's how I have to fight it.
Lantry never suspected she was a diabetic until she collapsed and was taken to the hospital. She would later discover her blood sugar was more than 12 times the normal level, levels that could have killed her. Looking back, she says there were warning signs she missed. The most common symptoms are excessive thirst, frequent urination, extreme hunger, unexplained weight loss, and blurred vision. One problem is patients often attribute those symptoms to things like menopause or stress. Another is that for many, the symptoms of diabetes don't become apparent for years, long after permanent damage is done. Having your glucose levels checked regularly can catch the disease early, or better yet, catch it in the pre-diabetes stage. Doctors say if you're overweight or obese, you should have a fasting glucose test at least once a year. Outreach programs like this one, sponsored by St. Vincent's Charity Hospital, offer glucose, cholesterol, and blood pressure checks for free. While much attention and effort has been focused on adults with diabetes, type 2 diabetes is no longer strictly an adult disease. The rates of obesity are rising rapidly among children.
Obesity is clearly an epidemic in children, in the state of Ohio as well as in the country. About a third of the children in the state are overweight or obese. And we have data that show that obese children are more than 4 times as likely to get diabetes.
Taylor Smith is 13 and more than 200 pounds. She's been a type 2 diabetic since she was 10.
It's very scary. As an endocrinologist, I did not see type 2 diabetes in children until about 10, perhaps 15 years ago.
Unfortunately for kids like Taylor Smith, it's too late to prevent diabetes. It will always be a shadow she'll have to live with. But with diet, exercise, and proper medical care, diabetes need not overshadow her life.
Part of what's troubling about type 2 diabetes in this country is that millions of people have it and don't even know it, perhaps as many as 6 million. That's why screening is so important. So is knowing your risk factors, being overweight, poor diet, having a family history of diabetes, and people from certain racial and ethnic groups, including African Americans and Latinos, all have high rates of diabetes. To learn more about risk factors, screening, and prevention, visit our website at wviz.org/health. For all of us at IdeaStream, I'm Rick Jackson. Thanks for watching. And remember, knowledge is power if you want to escape living in the shadow of diabetes.
Funding for Diabetes, The Constant Shadow, comes from the Dr. Donald J. Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, providing medical information programming for individuals and families on IdeaStream's broadcast and educational channels, and by the Margaret Clark Morgan Foundation, the Woodruff Foundation, the McGregor Foundation, and the Community Foundation of Lorain County.